Hi, this video is for anyone that wants to take into consideration deep core weakness with higher level movements during exercise. As always, this is not a substitute for individualized care, but if you're ingesting this on my YouTube channel, please seek out someone about how to integrate that deep core system. I'm creating this for my clients that I have taught them this strategy before integrating this into movements. So first we want to think about deep core connection. So a lot of us know our primary movers, which are like our crunch muscles or our lateral muscles or our glutes. But after we grow humans, what happens is our deep core system that's quite deep in our body gets quite squishy. You might actually, if you palpate your abdomen, feel like, whoa, why is it so squishy? It's really that deep core system that baby has stretched out. So it doesn't mean that you can't do high level training as long as the pelvic floor is ready to go, of course. But we just want to be cognizant of what we're doing during movements. So I'm going to be going over a squat press today, a deadlift, and a kettlebell swing, okay? 3 higher level movements that it's really easy to cheat on. And if you integrate these principles, you'll actually find it's quite harder, and you'll start to notice when you're losing control. All right, so first, how do we activate our deep core system? Well, it depends on what kind of birth you've had. If you've had a cesarean birth, your pelvic floor might actually be too tight. So actually doing a Kegel or pelvic floor lift on top of the TA or the deep core activation might lead to some issues, okay? But I'm going to bias this for someone that has had a vaginal birth that's still working on pelvic floor strength and TA strength. So there is variability depending on your presentation. I just don't want anybody to follow this to the T and end up with things like hemorrhoids or leakage or prolapse symptoms or pelvic pain or back pain. If you're getting any of those things with this, that means that something's just off in your intra-abdominal pressures, okay? So first, the breath setup for getting that deep core back is really important. We call this the umbrella breath or the reverse Kegel in pelvic health. So you want to squeeze your hands in the bottom of your rib cage. As you breathe in, you want to expand that rib cage side to side and front to back, and the viscera or the abdomen should expand as well. If you're up here, okay, you're not getting a good activation. I'll go over posture when I'm doing the weightlifting, but generally it's easier to activate this system, especially postpartum, if we just bring our center of gravity forward a little bit. So I'm just leaning through the ankles, okay? So breathing in and out. And I've really retrained my deep core system, so this is quite easy. And this breath alone takes work. So breathing in and out. Great. So the second thing that we want to think about is pelvic floor activation. So there's lots of different ways to activate your pelvic floor, but generally there's 3 layers: the back, the middle, and the front. To activate the back of the pelvic floor, you want to think about bringing your rectum towards your perineal body and pulling the perineal body up inside your body towards your head, okay? The middle pelvic floor, if you think about where your labia are, you want to squeeze your labial together and up. The upward motion is very important. And then the anterior pelvic floor, which is really difficult to activate for a lot of us, you want to think about pulling your clitoris inside of your body, and when you do that, you'll definitely feel this lower TA. We want to cue this for most people, not all people, but most people on exhale, okay? So breathing in and exhale, rectum towards perineum, labial squeeze and lift, clitoris lift, and that's the pelvic floor activation. If you do this well, if I do this to the side, you'll actually notice there is no change in my pelvic alignment and there's no change in my back alignment. That's how we know we're connecting to the deep core system. If you're over gripping, you'll see changes in the back and the pelvis. You'll see this kind of thing happening. And that will actually create a downward pressure. So on a healing pelvic floor, that might not be the best thing. All right. So again, I do just a little bit of a forward lean, breathing in. Exhale. Great. Now, after the pelvic floor activation, we want to do the TA activation. So there's the lower TA, the middle TA, and the upper TA. I'm going to cue all three levels, but you may be different depending on where you are. And if you're a client of mine, just refer to your notes that you've received this video of what exactly I'd like you to focus on right now. Okay, so breathing in, exhale. Rectum towards perineum, labial squeeze, clitoris lift. Now lower TA, you're thinking about pulling the hip bones in and up, okay, that upward motion. Middle TA, pulling the belly button in and up. And then upper TA is pulling the rib cage down. That's a full deep core set, okay? And I'll do this from the side. So leaning forward makes it a little bit easier. I'm doing a little bit of a posterior pelvic tilt here just because of my posture, and we'll go over that a little bit in a moment. So just ignore my posterior pelvic tilt for now, okay? But it's easier for me to connect. Breathing in, exhale, posterior forward, labial squeeze, clitoris lift, and you'll see there's no change. Lower TA, squeeze and lift, middle TA, squeeze and lift, then upper on. That's a full core set. That is a full deep core set, okay? So we want to integrate that into the movements, because what happens when we train higher level and we're postpartum and that deep core system's not back is we rely on our primary movers like our rectus abdominis and our glutes, which can contribute to leakage, and the pelvic floor just can't handle it. So that's why we want to do this deep core system. Now, posture. The most common posture I see postpartum is what I call the mom posture, which is this, okay? The pelvis can actually change quite a bit, but mom posture is kind of this overloading of the middle of the back just because all of this is weak. The very simple correction, if you look in the mirror and you're like, oh girl, I look like that, the very simple correction is growing tall and over, so you're stacked. Your sternum is in line with your pubic bone. Now, in terms of pelvic alignment, some people tend to be bum grippers and their butt's underneath them, and some people like me tend to have this sway back. It depends on how your body compensated during pregnancy. A lot of this is genetic. So for me, I need a tiny, tiny posterior pelvic tilt. We don't want the bum underneath us. For some people, they actually want to untuck. So it really depends on who you are as a person. I just need a water break because I'm working so hard here. So alignment's really important. So that's a long-winded way of how to stack the core. Okay, now let's go into movements. So we're gonna start with a squat press, okay? So I'm gonna do this to the side so you can see my form. I'm gonna lean forward a little bit, and even watch my core here. Even when I lean forward a little bit, you'll see my core pop on. Now, depending on where you are, if your deep core system can't handle this, you'll notice your top grip and bear down. That's a good indication you need to lower your weight, okay? Especially if you're early postpartum. So stack these weights, okay? I have 10 pounds, but you might want to start smaller, okay? Leaning forward a little bit. I'm going to posteriorly pelvically tilt my bum. Breathing in, exhale, pelvic floor on, deep core system on, up, up, stack the ribs, squat, and then press. Now what we want to avoid, and if I completely relax my core, is squat. I can perform a squat press, but you see how my ribs flare out the top? If we're looking for effective core training, we just want to avoid that rib flare. And often that is what contributes to leakage. Because if we're flaring those ribs, we just don't have control of that intra-abdominal pressure, and then there's leakage. Okay, so we'll do that again. Stack, forward lean, breathe in, exhale, set the deep core, pelvic floor, lower TA, middle TA, and then stack that upper TA, squat, and press, okay? Great, so try it on yourself. Now for deadlift, I'm gonna go over what most people will do with deadlift when their deep core system's weak. They'll come down, they'll come back up, and then they grip their butt, and they end up in mom posture. Don't do that, girl, okay? So again, the same principles apply. I pull my shoulders back and set my lats, so I'm squeezing imaginary oranges under my armpits. I'm coming forward, okay? I'm doing a posterior pelvic tilt because that's my setup. Breathing in, deep core set, stack the ribs, perform the movement coming up. Keep that upward motion of the core and set. You'll notice that I'm not coming back into that lean, okay? So again, shoulders back, breathing in, set the core, coming down, up, and keep that core strong and set. I'm still activating my glutes, but I'm just not over activating my glutes, okay? The third motion we'll go over is a kettlebell swing. So just like the other motions, you can come down and really like rely on passive structures here, and you might not even leak. But in the vein of really trying to retrain this core system, let's just make it better. And you can see how difficult this gets with timing. It takes practice, okay? So leaning forward a little bit, posterior pelvic tilt, okay, for me. I'm gonna breathe in, I'm gonna quick set, okay, and you'll see how I'm nice and strong at the top. Other side, breathe in, quick set, nice and strong at the top, okay? As you get better at it, you'll be quicker, okay? So I can do 1, 2 because I've been doing this for a long time, okay? So take it slow, modify as needed. If you have any questions, let me know below if this is on my YouTube or Instagram. But if you're a client and you're getting this through Inbodia, feel free to email me. So have fun. I'm super excited that I just made this video. Bye.